Okay, so in this part of our discussion, we'll talk about the circle of Willis. So, as you all know, that brain is supplied by in the branches of the internal carotid artery, vertebral artery, and the branches of the basilar artery. So, some of the branches of the internal carotid artery and the basilar artery they anastomose, and they form this circular vascular network that is known as circle of Willis. So, we will see the formation of the circle of Willis. Then we will see the location of the circle of Willis and what are the arteries that they form the circle of Willis, and then we move on to the clinical aspect of this circle of Willis. So let's start. Okay, so in this diagram you can see the brachiocephalic artery. This is the brachiocephalic artery. Then you have this common carotid artery, and this common carotid artery at the level of the superior border of the thyroid cartilage. You can see this is the thyroid cartilage. So at the superior border of the thyroid cartilage, it divides into two branches. One is your external carotid, and this one is your internal carotid. So this external carotid is giving so many branches that supply the face, the neck region, and this is the internal carotid that is basically for the vascular supply to the brain. So this internal carotid is having four parts. So anatomically it is divided into the four part. One is the cervical part that lies in the neck region. So you can see here from the origin of the internal carotid artery up to the entrance into the cranium. This whole vertical part is your cervical part. Next we have petrous part. So this internal carotid artery enters the carotid canal. It travels in the carotid canal. So the part of this internal carotid artery that is lying inside the carotid canal is known as the petrous part of the internal carotid artery. Next we have the cavernous part of the internal carotid artery, and this cavernous part, after traversing to the carotid canal, it enters into the cavernous sinus that is lying on the lateral side of the body of the sphenoid of the sella turcica. So it enters the cavernous sinus, and then it enters at the level of the anterior clinoid process. It pierces the durameter, and it becomes the fourth part, and that is your cerebral part. So this is the four part of the internal carotid artery. One is the cervical part, then we have the petrous part, then cavernous, and the cerebral part. You can see that this cervical part of the internal carotid artery is not having any branches. So one important MCQ question is framed often: which part of the internal carotid artery do not give any branches? So your answer will be the cervical part. The cervical part of the internal carotid artery is not having any branches. Next, this petrous part of the internal carotid artery is having two branches. One is your carotico-tympanic branch, and the one is your median branch or the pterygoid branch. Then this carotico-tympanic artery is basically supplying, it enters the middle ear and supplies the tympanic cavity. And next, the other branch of this petrous part of the internal carotid artery is your median artery. Then in the cavernous sinus, this internal carotid artery gives three branches. One branch is your for the trigeminal ganglion, that is the trigeminal ganglion. Then we have another branch that is the superior hypophyseal, and next we have the third branch of this cavernous part of the internal carotid artery, that is your inferior hypophyseal artery. So these three branches are arising from the cavernous part of the internal carotid artery, and this cerebral part is giving five branches. The anterior cerebral artery, then we have the middle cerebral artery. These two are the terminal branches of the internal carotid artery. Then the next branch of the cerebral part of internal carotid artery is your ophthalmic artery. Then we have the anterior choroidal artery, and next we have the posterior communicating artery. So these five branches are the branches of the cerebral part of the internal carotid artery. So this I have told you that the internal carotid artery is having the cervical part, the petrous part, the cavernous part, and the cerebral part. From the origin from the origin from the common carotid artery up to the entrance of the carotid canal. This is the cervical part, and it lies in the neck region. This is the vertical part, and it is not having any branches. Then we have the petrous part of the internal carotid that is traveling in the carotid canal, and then we have the cavernous part that lies in the substance of the cavernous sinus and giving three branches. Then we have the cerebral part. When this artery enters the that pierces the durameter and becomes lies in the subarachnoid space. Then that part becomes the cerebral part, and that cerebral part is giving five branches. So this is all about the anatomical parts of the internal carotid artery. So next we have another classification for the internal carotid artery, and that is divided into the internal carotid artery is divided into seven segments, and these seven segments are known as the Bacillar classification. So the Bacillar classification is relevant in case of the angiography of the internal carotid artery. So these seven segments of the internal carotid artery are named as the C1, that is cervical part. Then we have the C2 part, the C2 segment, that is petrous part. So next we have so like that we have the seventh segment of this internal carotid artery. So the first segment, that is the cervical segment, that is from the common carotid bifurcation to the carotid canal. So this cervical part that lies, the vertical part that lies in the neck region, is basically the common the C1 part of the internal carotid artery. So the next is the C2 segment that lies in the carotid canal up to the foramen lacerum. So this whole length of the internal carotid is the C2 segment or the petrous segment. Then we have a lacerum segment or the C3 segment as the internal carotid artery traverses the foramen lacerum. So up to the level of the petroclinoid ligament. So up to the level of the petroclinoid ligament, we have the third segment of this internal carotid artery. Then we have the cavernous part, and that is from the petroclinoid ligament to the proximal deuteral ring. And the internal carotid artery lies within the cavernous sinus and with the abducens nerve that lies lateral to it. So this cavernous part is basically the C4 segment. Then we have the clinoid part or the C5 segment that lies between the proximal and the distal dural ring. Basically it is a transition zone from the dural to the subarachnoid space. So when this internal carotid artery that pierces the durameter near the anterior clinoid process, then that part of the internal carotid artery is known as C5 segment or the clinoid segment. Next we have the C6 or the ophthalmic segment from the distal dural ring to the origin of the posterior communicating artery. The whole length of the internal carotid artery becomes the part of the ophthalmic segment or the C6 segment, and the internal carotid artery is now it lies in the subarachnoid space. So the last segment of this internal carotid artery under Bacillar classification is your C7 segment, and from the posterior communicating artery to the internal carotid artery bifurcation into the middle and the anterior cerebral artery. This length is known as the seventh segment or the communicating segment. So this seventh segment is important in case of the angiographic studies. So you have to remember these seven segment that is by the Bacillar classification. So next you can see here the another artery, that this is your vertebral artery. So this vertebral artery is arising from the first part of the subclavian artery. So you can see this is the subclavian artery over here, and this subclavian artery from the first part of this subclavian artery, you are seeing the origin of artery that is known as vertebral artery. And this vertebral artery first it travels in the scalene triangle, and after that at the apex of the scalene triangle it enters into the foramen transversarum of the C6 vertebra, and then from C6 vertebra it runs vertically upward to the upper six foramen transversarum, and when it reaches at the level of the atlas vertebra, then it travels through this foramen transversarum of the atlas vertebra, and then it moves posteriorly in a groove on the atlas vertebra, and it lies in the region of the suboccipital region. So this is the region of the suboccipital region, and this is the part of the vertebral artery that lies in the suboccipital region. So in this suboccipital region, it pierces the posterior atlanto-occipital membrane, and you can see here the two vertebral artery. It enters the foramen magnum, and you can see the two vertebral artery. They unite and they form a single basilar artery. So this basilar artery is lying in the basilar groove on the pons. You will see the pons is having a groove on the ventral surface. So in the median plane. So in that median groove, the basilar artery lies. And this basilar artery, you can see here, this basilar artery posteriorly, and this internal carotid artery anteriorly, they anastomose and they form a circular or the hexagonal structure over here, and this is basically the circle of Willis. So this network of the vascular channel is known as circle of Willis. You can see the basilar artery is giving some branches, and the internal carotid artery giving some branches. These two parts, they get unite, or they form a network, and that becomes the circle of Willis. So this was the basis, the anatomy. So next, okay, so in this specimen you can see this is the this is the anterior side. You can see the ventral surface, or the base of the brain. So this is the ventral surface, inferior surface, or the base of the brain. So here this side is your anterior side, and this is your posterior side. So you can see this is the frontal lobe of the cerebral hemisphere. You can see the temporal lobe of the cerebral hemisphere on both sides. Then you will find here you can see this is actually this area what you're seeing here. This is the cerebellum. So this is the cerebellum, and you can see from in the midline you can see this is the part of the midbrain. This is the part of the pons, and this is the part of the medulla. So you can see the structures of the midbrain. The brainstem, that is your midbrain, the pons, and the medulla over here. So this is the enlarged view to show the area that is known as interpeduncular fossa. So around this interpeduncular fossa, you will find the anastomosis of the vessel, and that is known as circle of Willis. So first of all, you must know the boundary of this fossa, that is known as interpeduncular fossa. So if I have told you that this side is anterior side, so anteriorly the boundary of the interpeduncular fossa is formed by the optic chiasma. You can see the optic nerve over here. So this optic nerve, it crosses and forms a chiasma. So this what you are seeing here, this is your optic chiasma. So the anterior boundary of this interpeduncular fossa is formed by this optic chiasma, and anterior laterally you will find the optic tract. So this is the region of the optic tract, and posteriorly if you see the posteriorly it is formed by the part of the pons. This is basically pons. So you will find the posterior boundary of this interpeduncular fossa is formed by this pons, and then you can see here the white structure over here. This is basically the cerebral peduncle. So cerebral peduncle, that is the part of the peduncle. So because this cerebral peduncle is a part of the midbrain, so you will find posteriorly the cerebral peduncle or the crus cerebri. Then more posteriorly you will find the part of the pons, and then anterolaterally you will find this optic tract, and anteriorly you will find this optic chiasma. So the optic chiasma, the optic tract, the upper border of the pons, So the upper border of the pons and the crus cerebri or the cerebral peduncle, they form this whole area, and that is known as interpeduncular fossa. So you can see this area is known as interpeduncular fossa, and around which you will find a circular network, hexagonal or the network of the vessel, and that is known as circle of Willis. So I have told you about the this interpeduncular fossa. So often you are asked in your Viva question, what are the content of the interpeduncular fossa? So you can see here this structure, this rounded elevation on the ventral surface of the brain at the region of the interpeduncular fossa, and this is known as mammillary body. So it is clear that mammillary body you can see here. So this is mammillary body, and anteriorly you will find infundibulum and the tuberous cinereum, and you can also see the posterior perforated substance, and this is the area of the posterior perforated substance. It is gray matter perforated by the posterior cerebral artery, and here you can see some branches of the posterior cerebral artery. So this is the area of the posterior perforated substance. So all these structures forms the content of the interpeduncular fossa. So you must know about the boundaries of the interpeduncular fossa and what are the structures that are lying in the interpeduncular fossa. And so around this, why I have told you about the interpeduncular fossa, because you can see the location of the circle of Willis. So this circle of Willis is lying this circle of Willis is lying around this interpeduncular fossa. So in this image you can see, okay, so I'm showing in this slide. So okay, so this is basically the part of the internal carotid. You can see it is giving this is giving a branch over here. This branch is the middle cerebral artery, and this is giving a branch over here. This branch is your anterior cerebral artery, and posteriorly it is giving another branch, and this is the posterior communicating artery. So these three branches are the branches of the internal carotid artery. So this anterior, if you talk about the anterior cerebral artery, it goes behind this optic tract, and it goes in the this is the frontal lobe of the cerebral hemisphere. So you will find a sagittal groove over here. This is all covered by the dura mater. This shiny structure what you are seeing here, this is basically the dura mater. So if you dissect this dura mater, so you will find a groove over here, and in this groove the both of the anterior cerebral artery, they traverse and they join by communicating branches. So the both the anterior cerebral artery, they are united by a anterior communicating branch. So you will find anterior communicating branch, communicating artery. Okay, so anterior communicating artery over here. So next, if we trace it from the lower side, this is the one side of the vertebral artery. Similarly, you will find the other side of the vertebral artery also. So these two vertebral artery, they fuse and form a single basilar artery. So the right and the left vertebral artery, they unite at the level of the lower border of the pons, or at the level of the pontomedullary junction. So here they unite and they form a single artery, and that is known as basilar artery. So this is your basilar artery. So this branch what you're seeing here is basilar artery. It is lying in the basilar groove of the pons, and you can see here at the upper part of this basilar artery you are seeing two branches. So this is this is of the one side, and this is of the another side. So you can see this is basically the posterior cerebral artery. So you have the posterior cerebral artery. So this posterior cerebral artery, and it is connected to internal carotid branches of the internal carotid through this posterior communicating artery. So you are seeing now this whole circle is completed. So you are seeing the anterior cerebral artery, they are united by the anterior communicating artery. You are seeing the posterior cerebral artery, and this posterior cerebral artery is united by this posterior communicating artery of the internal carotid artery. So this whole circular structure what you are seeing around this peduncular fossa, interpeduncular fossa, is basically the circle of Willis. So this is the location of the circle of Willis. So okay, so this is a diagrammatic representation of the circle of Willis. So here, this is I have already told you, this is the anterior side of the brain, of the inferior surface of the brain, and this is basically the frontal lobe. So this is frontal lobe. Okay, so posteriorly you are seeing the occipital lobe, and this what you are seeing here, this is basically the cerebellum. So cerebellum. So this is the posterior side, and this is the anterior side. So after that, okay. So this is the temporal lobe. So you are seeing a fossa over here. This is basically the interpeduncular fossa. So I have told you about the boundaries of the interpeduncular fossa. So anteriorly it is formed by the optic chiasma. Anterolaterally you will find the optic tract. Then posteriorly you will find the part of the pons. This is basically the pons. It is pons. So you will find the part of the pons that is forming the posterior boundary of the interpeduncular fossa, and these are the cerebral peduncle. This is structure what you are seeing. This is basically for the transmission of the um, tracts. So this peduncle is known as cerebral peduncle. So posterior laterally you will find the cerebral peduncle. So this whole fossa what you are seeing here is basically the interpeduncular fossa. You can see the mammillary body over here, and this is basically the tuberous cinerarium and the infundibulum, and this is the region of the posterior perforated substance. So this is a whole about the interpeduncular fossa. Now if you see around this interpeduncular fossa, you are seeing the part of this internal carotid artery. So this internal carotid artery is giving over here the middle cerebral artery, and that supplies basically the lateral surface of the brain. So this is your middle cerebral artery. Next we have this anterior cerebral artery that lies below this optic nerve. So this is the anterior cerebral artery, and it runs anteriorly in this sulcus. This is the sagittal sulcus of the cerebral hemisphere, and it is the two sides of this anterior cerebral artery are connected by this anterior communicating artery. So this is anterior communicating artery, and this is your anterior cerebral artery. So this is anterior cerebral artery. So this is your anterior cerebral artery. So okay, so next we have another branch from this internal carotid artery, and this is known as the posterior cerebral artery. So this artery, posterior communicating artery. Okay, so this is posterior communicating artery. Okay, posterior communicating artery. And okay, so this was all about the anterior segment. If we talk about from the posterior side, so here I have shown you about the vertebral artery. So this vertebral artery at the level of the pons and the medulla, at the junction of the pons and the medulla, it unite and it forms a single basilar artery. So this there are two vertebral arteries. So this is the vertebral artery. You can see a branch of the vertebral artery, that is your anterior spinal artery. It fuses at the level of the two anterior spinal artery. They fuse in the midline and they form a single anterior spinal artery. So at the level of the olive. So here you can see after formation of the basilar artery. Okay, after formation of the basilar artery, you are seeing here this basilar artery is giving some branches. So this basilar artery is giving its first branch, that is your anterior inferior cerebellar. So this is the cerebellum, and you can see it is divided into two parts: the inferior part, the anterior part and the posterior part. So the inferior surface of this cerebellum, anteriorly it is supplied by this artery, is your anterior inferior cerebellar artery, that is supplying the inferior surface of the cerebellum on the anterior side. So this whole anterior surface is supplied by this anterior inferior cerebellar artery, that is the branch of this basilar artery. Next we have a branch that is known as labyrinthine artery. So this labyrinthine artery, it enters in the internal auditory meatus, and it runs along with the seventh and eighth cranial nerve. Then you will find some smaller branches. They are known as Pontine Branches. You will find the Pontine Branches. Where at the upper end of this, you will find two branches. One is your superior cerebellar. One is your superior cerebellar artery, and the one is your posterior cerebral artery. So this area is the posterior cerebral artery. Posterior cerebral artery. Okay, the anterior cerebral and the middle cerebral are the branches of the internal carotid artery, while this posterior cerebral is branch of the basilar artery. So this posterior cerebral artery is connected to the internal carotid artery through this branch that is known as posterior communicating artery. So now you can easily make out this hexagonal or the circular structure, vascular network, that is known as circle of Willis. So at the base of the brain, or you can see at the inferior surface or the ventral surface of the brain, you will find this network, and this is known as a circle of Willis. So the importance of this circle of Willis is that the right side of the brain is supplied by the right part of the circle of the Willis, and the left side of the brain is supplied by the left part of the circle of Willis. So there is minimum mixing, or there is almost no mixing through this communication or the communicating artery. So there is no mixing of blood through this anterior communicating artery. So the right side, the one part is supplied by the right side of the circle of Willis, and the other part is supplied by the other half of the circle of the Willis. So in case of any obstruction, suppose the obstruction is just proximal to this is your anterior communicating artery. Suppose the obstruction is proximal to this anterior communicating artery. So there will be the formation of the collateral circulation from the opposite side, and this area, the blood supply of this area will not be hampered, and this will be taken care of by this opposite side of the anterior cerebral artery. So, but if the obstruction is that is your distal to this anterior communicating artery, suppose the obstruction is over here, so this area will suffer from ischemia, because after that there will be no collateral circulation. So this area of the brain will suffer from the ischemia. So there will be the ischemia if the obstruction is after this communicating artery. But if the obstruction or any pathology is before the anterior communicating artery, then that part will be supplied by the this collateral circulation of the opposite side. So this is one important clinical significance of the circle of Willis. So next we have, okay, so this is the same diagram. So I have told you about the obstruction. Okay, next we have, in some cases we will find a congenital anomaly of this Berry's aneurysm of this circle of Willis, and that is known as Berry's aneurysm. So this Berry's aneurysm is basically there is defect aneurysm. Okay, so this is basically there is a defect in internal elastic lamina. So the internal elastic lamina that is defected, and that will lead to the dilatation of this part, any part of this circle of Willis, and that will cause the that will lead to the Berry's aneurysm. If it is not ruptured, then the symptom must be taken care of. We usually give antihypertensive drugs, but if suppose this aneurysm is ruptured, then it will be an emergency case. So in that case we have to go for some surgical procedures, but if it is unruptured, then we treat the patient symptomatically. So these two important clinical aspects you must know. One about the collateral circulation. Suppose I have told you about the lesion if the obstruction is distal to the anterior communicating artery, then there will be no blood supply to this particular part of the brain, and that area will suffer from ischemia. But if the obstruction is below this anterior communicating artery, then definitely this the part is taken care by the other, and the collateral circulation on the other side. The collateral circulation will be established and this will be taken care of. Okay, so that's all for this circle of Willis, and that's all. Thank you.